Welcome back to the deep dive.
All right.
Today we're doing something a little different.
Cool.
We're going behind the scenes
Okay.
to explore the world of physical health assessments.
Interesting.
We'll be diving into nursing textbooks
Okay.
and study guides.
All right.
And even if you're not in the medical field, trust me,
Okay.
there's a lot we can all learn
Mm-hmm.
from these resources. Get ready to feel like you're back in nursing school,
All right.
but without the exams.
That's right. We're going to uncover those fascinating details
Okay.
about how nurses assess your health.
Cool.
It might even change the way you think about those regular checkups.
Okay, so let's break it down.
All right.
Nursing School 101
Mm-hmm.
tells us that health assessments have two main parts,
Okay.
the health history
Yes,
and the physical exam.
exactly. The health history is like gathering clues.
Okay.
What are your symptoms, past medical history,
Uh-huh.
family history, lifestyle?
Right.
It sets the stage for the physical exam,
Okay.
where the nurse steps in as a detective,
Oh.
observing and examining for clues
Right.
to understand what's going on.
So it's like a two-part mystery novel
Yes.
where the patient's story is chapter 1
Uh-huh.
and the nurse's exam is chapter 2.
Exactly.
Speaking of clues,
Yeah.
our source material mentions this acronym,
Okay.
PERLE,
Perle.
that nurses use. It sounds more like a secret code
It does, doesn't it?
than a medical term.
It stands for pupils equal, round, reactive to light,
Wow.
and accommodation.
Okay.
It's a shorthand way
Right.
for nurses to document if your pupils are functioning normally.
That's amazing. I never realized how much information
Right.
nurses can gather just from looking at someone's eyes.
Yeah.
But I'm curious,
Yeah.
are there any red flags
Oh, yeah.
nurses look for during a head and neck exam besides the eyes?
Definitely. One thing that stands out is checking the lymph nodes.
Okay.
You have these tiny bean-shaped organs
Okay.
all over your body,
Uh-huh.
including many in the head and neck area.
I've heard of lymph nodes, but honestly, I don't really understand what they do.
Well, imagine your lymphatic system as your body's security team,
Okay.
constantly patrolling for any signs of trouble.
Mm-hmm.
Lymph nodes are like security checkpoints,
Okay.
filtering out harmful substances
Right.
and housing immune cells ready to fight off infection.
Okay, so when those security checkpoints are swollen,
Yes,
it's a sign that something might be wrong.
exactly.
But there are so many lymph nodes in the head and neck.
Yeah.
Are some more important than others?
Good question. If you're thinking like a nurse,
Okay.
enlarged lymph nodes in certain areas
Mm-hmm.
can be more concerning.
Right.
For example, a swollen lymph node above the collarbone,
Uh-huh.
called the supraclavicular node,
Okay.
can sometimes signal a more serious issue that needs further investigation.
Wow. Yeah. I never knew that. I'll definitely be paying more attention to my own lymph nodes from now on.
Good idea.
So besides the eyes and lymph nodes,
Yep.
what else do nurses look for during a head and neck exam?
They also observe the thyroid gland,
Okay.
which sits in your neck
Mm-hmm.
and plays a key role in your metabolism.
Right.
What's interesting is that just by having you swallow a sip of water,
Oh, wow.
a nurse can observe your thyroid gland
Huh.
and look for any signs of enlargement.
That's surprising. I never realized
Yeah,
how much you could tell from something as simple as swallowing.
right?
It seems like nurses are trained to pick up on subtle details
They are.
that most people would miss.
Yes.
You're right, they are. And speaking of subtle details,
Okay.
let's talk about how nurses assess the senses.
Right.
Starting with vision. I'm
Okay.
sure you're familiar with those eye charts.
Yes.
With progressively smaller letters.
Uh-huh.
The Snellen chart.
The selling chart.
Oh, yeah.
Mhm.
I remember those from my last eye exam.
Right.
Is that all there is to it?
Well, no,
When nurses test vision.
not at all. They use that chart to assess visual acuity,
Okay.
how clearly you can see.
Right.
But they also check your peripheral vision, making sure you can see objects off to the side.
Right.
And they also test those pupillary responses we talked about earlier,
Okay.
using that handy PERLE acronym.
Wow. That's a lot to remember just from looking at someone's pupils. How do nurses keep all those acronyms straight?
Well, with practice
Right.
and repetition, it becomes second nature.
Okay.
It's like learning a new language.
That makes sense. And what about our other senses, like smell and hearing? Do nurses check those too?
Absolutely. When it comes to the nose,
Okay.
they'll examine its appearance,
Uh-huh.
making sure it's midline
Right.
and in proportion to your other facial features.
Okay.
Then they'll test the patency of your nostrils,
Huh.
which just means making sure air can flow freely
Right.
through each side.
So if I had a stuffy eyes, they'd be able to tell right away.
Exactly. Now for hearing,
Okay.
they might simply talk to you in a normal tone of voice
Uh-huh.
and observe your response.
Right.
If they suspect any hearing loss,
Okay.
they might use a tuning fork
Right.
to evaluate different aspects of hearing.
Okay.
These tests help them assess the function of your cranial nerves.
Cranial nerves.
Yes.
Those always sounded so mysterious to me.
Right.
What's the big deal with them?
Well, you have 12 pairs of cranial nerves
Okay.
that originate in your brain
Uh-huh.
and control various functions throughout your head and neck.
Oh, wow.
They're responsible for things like smell, taste,
Okay.
vision, hearing,
Mm-hmm.
facial expressions,
Right.
and even shoulder shrugs.
Wow.
Nurses assess the function of many of them.
Okay.
But for today, let's focus on two particularly intriguing examples.
All right.
Cranial nerve 7,
Okay.
also known as the facial nerve,
Uh-huh.
and cranial nerve 8,
Okay.
the acoustic or vestibulocochlear nerve.
Okay, tell me more. What makes these two cranial nerves so special?
Cranial nerve 8, the facial nerve,
Mm-hmm.
controls the muscles in your face,
Okay.
allowing you to make expressions like smiling, frowning,
Right.
or raising your eyebrows.
Okay.
It's also involved in taste sensation
Uh-huh.
from the front 2/3 of your tongue
Okay.
to test its function.
Right.
A nurse might ask you to smile, frown,
Right.
bucket your cheeks,
Mm-hmm.
or close your eyes tightly.
That sounds like a fun test.
It is.
What about cranial nerve 8?
Okay.
What does it control?
Cranial nerve 8, the acoustic or vestibulocochlear nerve,
Okay.
is all about your senses of hearing and balance,
Right.
as we discussed.
Okay.
A nurse might talk to you to assess your hearing,
Right.
and they might also use a tuning fork to test different aspects of your hearing.
Okay.
For balance, they might observe your gait
Mm-hmm.
or ask you to stand with your eyes closed.
So by testing these specific nerves,
Yes,
nurses can get a better understanding of how your senses are functioning.
precisely. It's like having a direct line to these important nerves
Wow.
to see if they're working properly.
This is all so fascinating.
I know, right?
I'm starting to see how each part of the physical exam is like a puzzle piece,
Mm-hmm.
giving nurses a clearer picture
Uh-huh.
of the client's overall health.
Exactly.
And speaking of puzzle pieces,
Yeah,
I know there are a few body systems we haven't touched on yet.
right.
Like the chest, heart, breasts, abdomen.
You're absolutely right. A thorough physical assessment includes all of those areas
Okay.
after checking the head and neck.
Uh-huh.
The assessment moves down to the chest,
Okay.
where nurses pay close attention to your heart and lungs.
Right.
They will use a stethoscope to listen to your heart and lung sounds.
Okay.
And will check your breathing.
So after the head and neck, it's
Mhm.
on to the chest.
Yes.
What happens after that?
After examining the chest, the assessment moves to the abdomen.
Okay.
The nurse will check your abdomen for any tenderness,
Mm-hmm.
and they will also listen for bowel sounds using the stethoscope.
It seems like the stethoscope is a pretty important tool for nurses.
It's definitely one of their most important tools.
Yeah.
It allows them to hear sounds
Right.
that are happening inside your body
Okay.
that wouldn't be audible otherwise.
That makes sense. So we've covered the head and neck,
Yes.
the chest,
Uh-huh.
and the abdomen.
Yes.
What other areas do nurses examine during a physical assessment?
Well, they also examine the extremities,
Okay.
which means your arms and legs.
All right.
They'll check your pulses, assess your reflexes,
Uh-huh.
and look for any signs of swelling or abnormalities.
It's amazing how thorough these assessments are.
It is, isn't it?
It sounds like nurses need a really strong understanding of anatomy and physiology.
They absolutely do.
Wow.
And they also need excellent observation skills,
Mm-hmm.
critical thinking skills,
Right.
and communication skills.
Speaking of communication,
Yeah.
I noticed our source material emphasized personal hygiene quite a
Oh,
bit.
yes.
Why is that such a big deal during a health assessment?
It's important to remember that a health assessment is about more than just gathering information.
Okay.
It's also an opportunity for the nurse to educate you
Right.
and promote healthy habits.
Okay.
Personal hygiene plays a crucial role in overall health
Uh-huh.
and can prevent a wide range of problems.
I hadn't thought about it that way.
Yeah.
But it makes a lot of sense. By talking about hygiene during an assessment, nurses are essentially weaving health education
They are.
into the interaction.
Exactly. And it's not just about promoting good habits for the sake of the assessment itself.
Right.
It's about empowering you to take control of your health and well-being.
Okay.
Nurses often use the health assessment as an opportunity to educate you about hand washing,
Uh-huh.
oral care,
Right.
and other hygiene practices that can have a real impact on your health.
That's a great point. It's like they're saying, we're not just here to check your vital signs.
Mhm.
We're here to help you live a healthier life.
Precisely. Now, before we move on,
Okay.
I want to touch on another crucial aspect of nursing, Safety.
Okay, let's talk about safety. I know hospitals have all sorts of rules and regulations,
You do.
but what makes safety such a big focus for nurses specifically?
Safety is paramount in healthcare.
Okay.
Nurses are responsible for your well-being
Mm-hmm.
while you're in their care,
Right.
and they're constantly thinking about how to keep you safe from harm.
Okay.
This includes everything from preventing falls to administering medications correctly
Uh-huh.
to maintaining a clean and sterile environment.
That makes sense. I imagine safety is especially important in a hospital setting.
Oh, absolutely.
There are so many potential hazards.
You're absolutely right. Hospitals are complex environments
Right.
with lots of equipment,
Mm-hmm.
medications,
Yeah.
and people moving around.
Right.
It's a nurse's job to be aware of all these potential hazards
Okay.
and take steps to mitigate them.
So what are some specific examples of safety measures that nurses take?
Well, let's start with something as simple as electrical safety.
Okay.
Nurses are very particular about using three-pronged electrical cords
Right.
and making sure all equipment is properly grounded.
I'll admit I've been guilty of using a two-pronged adapter
Oh, yeah,
when an outlet is too far away.
right.
I never really thought about it being a safety hazard.
It might seem like a small thing,
Yeah.
but using the wrong type of plug can increase the risk of electrical shock,
Okay.
especially in a hospital setting where there's a lot of moisture
Uh-huh.
and medical equipment in use.
Okay. That's a good reminder to always use the right equipment.
Yes.
What about other safety measures?
Hmm.
I know
Yeah.
hospitals use safety devices like restraints sometimes.
You're right. Restraints, whether they're physical or chemical,
Okay.
are sometimes necessary to keep patients from harming themselves or others.
Right.
However, they're always a last resort.
Okay.
Nurses are trained to use alternative methods first,
Right.
such as reorientation,
Okay.
distraction,
Okay.
or providing more frequent checks.
So it's all about finding the least restrictive way to ensure everyone's safety.
Exactly.
What about fire safety?
Okay.
I know hospitals have strict protocols in place for fires.
Absolutely. In fact, there's a mnemonic
Oh,
that nurses use to remember the steps they should take in case of a fire.
okay.
It's called RACE.
RACE.
Yes.
What does that stand for?
It stands for Rescue, Alarm, Contain, and Extinguish.
Wow.
First, you rescue anyone in immediate danger.
Okay.
Then you pull the alarm to alert others.
Right.
Next, you contain the fire if possible
Okay.
by closing doors and windows.
Right.
And finally, you extinguish the fire if it's safe to do so.
Rescue, alarm, contain, extinguish.
Yes.
Got it.
Good.
That's a really helpful way to remember the steps.
It is.
So we've talked about electrical safety,
Mm-hmm.
the use of restraints,
Yes.
and fire safety.
Right.
What other safety concerns are top of mind for nurses?
Well, infection control is another huge priority.
Sure.
Nurses are meticulous about maintaining a clean and safe environment
Uh-huh.
to prevent the spread of infections.
That makes sense. Hospitals see a lot of sick people,
Right.
so infection control must be crucial.
Exactly. One of the most important ways nurses prevent the spread of infection is through hand hygiene.
Okay.
You'll see them washing their hands frequently
Right.
and using hand sanitizer before and after interacting with patients.
I've definitely noticed that nurses are very diligent about hand washing.
They are.
But what about those gloves, gowns, and masks that they sometimes wear?
You're talking about personal protective equipment,
Okay.
or PPE.
Right, PPE.
Nurses use PPE when there's a risk of coming into contact with bodily fluids,
Okay.
like blood or saliva.
Okay, so PPE is all about protecting themselves
Yes,
and their patients from potential infections.
exactly.
What are some specific types of PPE that nurses use?
The most common types of PPE are gloves,
Okay.
gowns,
Mm-hmm.
and masks.
Right.
They also sometimes wear eye protection,
Uh-huh.
like goggles or face shields,
Okay.
if there's a risk of splashing.
Right.
And depending on the situation,
Okay.
they might also wear shoe covers or head coverings.
So it sounds like PPE is an important part of keeping everyone safe from infections.
It is.
But how do nurses know when to wear PPE?
Well-
Is it just a matter of personal preference?
Not at all. There are very specific guidelines that nurses follow
Okay.
to determine when PPE is necessary.
Right.
These guidelines are based on the type of patient interaction
Mm-hmm.
and the potential for exposure to infectious materials.
So it's not just a random decision. There's a lot of thought and consideration that goes into it.
Exactly. And not only do nurses need to know when to wear PPE,
Okay.
but they also need to know how to put it on and take it off correctly.
Right.
There's a specific order
Okay.
for donning and removing PPE
Uh-huh.
to minimize the risk of contamination.
That's interesting. I never realized there was a specific order for putting on and taking off PPE.
Oh, yes. You can't just throw it on and off any which way.
Right.
If you don't follow the correct procedure, you could actually increase the risk of spreading germs.
Wow, that's good to know. I'll definitely be paying more attention to how healthcare workers handle PPE in the future.
Good idea.
But switching gears a bit,
Okay?
I found it interesting that our source material mentioned anthrax.
Anthrax.
Yeah.
Yes, that's a serious infectious disease that can be fatal.
Right.
Thankfully, it's not something you encounter every day.
Right. I've heard of anthrax, but don't really know much about it. What is it exactly?
Well,
And how do people get it?
anthrax is caused by a bacterium called Bacillus anthracis.
Okay.
It's primarily a disease of animals.
Right.
But humans can get infected through contact with infected animals or animal products.
Okay.
In rare cases, it can also be spread through intentional release
Uh-huh.
as a bioterrorism agent.
That sounds scary. So it's a reminder that nurses need to be prepared for a wide range of potential health threats.
Right.
Even rare ones.
Exactly. And they need to be able to recognize the signs and symptoms
Mm-hmm.
of various infections, including anthrax,
Right.
so they can take the appropriate steps to protect themselves and their patients.
That makes sense. It's clearly nurses have a lot of responsibility when it comes to safety and infection control.
They do.
But let's circle back to the assessment process itself.
Right.
I know nurses are constantly gathering data,
Yes.
but how do they make sense of it all?
That's where their critical thinking skills come into play.
Okay.
Nurses need to be systematic,
Right.
factual,
Uh-huh.
and accurate in their assessments.
Okay.
They can't just rely on intuition or guesswork.
Right.
They have to be able to distinguish between objective data,
Okay.
which is what they observe,
Right.
and subjective data,
Okay.
which is what the patient reports.
Okay. Can you give me an example of objective versus subjective data?
Sure, let's say you go to the doctor and tell them you've been experiencing headaches.
Right.
That's subjective data because it's based on your personal experience and perception.
Okay.
But if the doctor takes your temperature and finds that you have a fever, that's objective data
Right.
because it's a measurable finding.
So it's about piecing together the whole story,
It is.
using both what the patient tells you
Mm-hmm.
and what you observe.
Exactly. And there's this really interesting method called PCAM, the patient-centered assessment method.
Who's Sam?
Yes.
Okay.
That takes into account not just physical symptoms,
Right.
but also the patient's social and environmental factors.
Right.
It recognizes that health is not just about the body.
Uh-huh.
It's about the whole person.
PSAM.
Yes.
I've never heard of that before. What makes it different from other assessment methods?
Well, traditional assessment methods
Okay.
tend to focus primarily on the physical aspects of health,
Right.
but PCAM takes a more holistic approach,
Okay.
recognizing that your social, emotional, and environmental well-being all play a role in your overall health.
I like the sound of that. It seems much more comprehensive and individualized.
It is.
So how does PCAM work in practice?
It starts with gathering information about your medical history, lifestyle,
Okay.
and current concerns, just like a traditional assessment.
Right.
But then it goes a step further by exploring your social determinants of health.
Social determinants of health.
Yes.
What does that mean exactly?
It refers to the conditions in which people are born, grow, live,
Right.
work, and age.
Okay.
These factors can have a huge impact on your health.
Mm-hmm.
For example,
Yeah.
do you have access to healthy food and safe housing?
Right.
Do you have a support system?
Okay.
Do you face any barriers to health care?
I can see how those factors would be really important. So by taking all of this into account,
Yes,
PCHAM helps nurses get a more complete picture of the patient's health.
precisely. It helps them identify potential risks and tailor their care
Okay.
to your individual needs.
Right.
Instead of just treating the disease, they're treating the whole person.
That's amazing. I'm starting to understand why nursing is considered both an art and a science.
It is.
It's about combining knowledge
Yes.
with intuition
Uh-huh.
and compassion,
You're absolutely right. It requires a special kind of person to be a nurse.
right?
They need to be intelligent, compassionate,
Mm-hmm.
and dedicated to helping others.
Well, I'm feeling a lot more informed about the world of health assessments after this deep dive.
Good.
I never realized how much detail and critical thinking goes into it.
It's definitely more than just checking your pulse and temperature.
That's for sure. I'm curious to hear more about how nurses use all of this information to actually care for their patients.
Well, that's a perfect topic for our next segment. We'll explore how nurses analyze the data they gather,
Okay.
identify potential problems,
Uh-huh.
and develop plans of care.
Great. Looking forward to it.
Me too.
So we've talked about how nurses gather all this data during a health assessment,
Right.
using both objective and subjective information.
Yes?
It's fascinating how they take into account not just your physical symptoms, but also those social and environmental factors through that PCAN approach.
Uh-huh.
But once they have all this information, what happens next?
Well,
What do they actually do with it?
that's where the real detective work begins. Think of it like this. You wouldn't just throw all the ingredients for a cake into a bowl and hope for the best, right?
Right.
You need a recipe,
Okay.
a method to organize and make sense of it all.
Okay, so what's the recipe for analyzing all that patient data?
There are different approaches, but one common method is to cluster the data into meaningful categories.
Okay.
Some nurses might organize the information according to Gordon's functional health patterns,
Okay.
which focus on areas like nutrition, sleep, activity, and coping.
Right.
Others might use a head-to-toe format, going systematically through each body system.
So it's like sorting through all the puzzle pieces and grouping them by color or shape before you start putting the puzzle together.
Exactly. And once you have the data clustered, you start looking for patterns and connections.
Okay.
Are there any red flags?
Uh-huh.
Is there anything that doesn't quite add up?
Right.
This is where critical thinking really comes into play. It's not just about collecting data.
Right.
It's about interpreting it, analyzing it,
Okay.
and using it to make informed decisions about patient care.
So it sounds like nurses need to be really good at connecting the dots.
They do.
They have to be able to see the big picture
Yes.
and identify potential problems, even if the clues are subtle.
You're absolutely right. Sometimes the clues are very subtle, like a slight change in vital signs or a new report of fatigue.
Right.
But to an experienced nurse, those subtle clues could be just as significant as a more obvious symptom.
It's amazing how much nurses have to pay attention to.
It is.
But let's say they've analyzed all the data
Okay.
and identified a potential problem.
Mm-hmm.
What happens next?
Well, the next step is to develop a plan of care.
Okay.
This plan outlines the goals for the patient's care, as well as the specific interventions that will be used to achieve those goals.
So it's like a roadmap for the patient's journey back to health.
Exactly. And this plan of care is not set in stone.
Okay.
It's a dynamic document that could be adjusted as needed based on the patient's progress and changing needs.
So it's a collaborative process between the nurse and the patient.
Absolutely. It's essential for nurses to involve their patients in the development and implementation of their care plan.
Okay.
This ensures that the plan is aligned with the patient's goals, values, and preferences.
That makes a lot of sense. It's not just about telling patients what to do. It's about empowering them to take an active role in their own care.
Precisely. And speaking of empowering patients, let's talk about the role of patient education.
Okay.
We discussed earlier how nurses promote good hygiene practices during health assessments.
Right.
But what other kinds of health education do they provide?
That's a great question. It seems like patient education would be a really important part of nursing.
It is.
After all, if patients don't understand their condition or how to manage it,
Mm-hmm.
they're less likely to follow through with their care plan.
You're absolutely right. Patient education is a fundamental aspect of nursing.
Okay.
It's about providing patients with the knowledge and skills they need to manage their health and make informed decisions.
So what are some common topics that nurses cover during patient education sessions?
It really depends on the individual patient's needs and circumstances.
Right.
But some common topics include medication management, wound care, disease prevention,
Uh-huh.
and even just basic information about how to maintain a healthy lifestyle.
So it can be anything from explaining how to properly use an inhaler
Yes,
to discussing the importance of a balanced diet and exercise.
exactly. And it's not just about providing information.
Right.
It's also about addressing the patient's concerns
Okay.
and answering their questions in a way that they can understand.
It sounds like nurses need to be really good communicators.
They absolutely do. Effective communication is essential for building trust, establishing rapport,
Okay.
and ensuring that patients feel heard and understood.
It seems like that would be especially important when dealing with sensitive topics, like sexual health or end-of-life care.
You're right. These conversations can be challenging, but they're crucial for providing holistic and patient-centered care.
Right.
Nurses need to approach these topics with empathy, sensitivity,
Uh-huh.
and a willingness to listen without judgment.
That makes sense. Now, I know we're nearing the end of our deep dive, but there's one more important topic I want to make sure we touch on: cultural sensitivity.
Ah, yes. That's a critical aspect of providing truly patient-centered care.
Right.
It's about recognizing and respecting the diverse beliefs, values, and practices of our patients.
It seems like cultural sensitivity would be particularly important in a country like the United States,
Mm-hmm.
but it's so diverse.
You're absolutely right. As our society becomes increasingly multicultural,
Right.
it's more important than ever for healthcare providers to be culturally competent.
So what does cultural competence look like in nursing practice?
It involves being aware of your own biases and assumptions,
Okay.
being open to learning about different cultures,
Uh-huh.
and adapting your care to meet the unique needs of each patient.
So it's not a one-size-fits-all approach.
Right,
Nurses have to tailor their care to fit the person, taking into account their cultural background.
exactly. And this might involve things like using a translator,
Okay.
being mindful of dietary restrictions,
Uh-huh.
or simply being willing to listen to and learn from the patient's perspective.
It's all about meeting patients where they are, both literally and figuratively.
Precisely. Now, before we move on to our final thoughts,
Okay.
I want to circle back to something we talked about earlier, the recipe for analyzing patients' data.
Right. We talked about clustering the data, looking for patterns, and using critical thinking to make sense of it all.
Yes.
What else is important?
Well, there's one more key ingredient I want to highlight. Intuition.
Intuition. You
Yes,
mean like a gut feeling?
exactly. Experienced nurses often develop a kind of sixth sense about their patients.
Okay.
They can just sense when something isn't quite right, even if they can't put their finger on it.
So it's about combining their analytical skills
Yes,
with their intuition to get a complete picture of what's going on with the patient.
precisely. It's a delicate balance, but it's essential for providing truly holistic care. You have to be able to see the data, but you also have to be open to what your intuition is telling you.
I've heard of doctors having that gut feeling,
hmm
but I never thought about nurses having it too.
Oh, it's very real. And sometimes that intuition can be life-saving. There are countless stories of nurses who had a hunch that something was wrong with their patient even when all the vital signs looked normal.
Wow.
And because they trusted their gut, they were able to intervene early and prevent a serious complication.
That's incredible. It really highlights the human element of nursing. It's not just about following protocols and checking boxes.
It's not.
It's about connecting with patients on a deeper level and being attuned to their subtle cues.
You've hit the nail on the head. Nurses is so much more than just a job. It's a calling, a vocation.
Well said. I have to say, after this deep dive,
Yes.
I'm feeling a newfound respect for nurses
Good.
and the incredible work they do.
I'm glad to hear that. They truly are unsung heroes working tirelessly behind the scenes to care for their patients.
Okay, before we get too sentimental,
Right?
I think it's time to move on to our final thoughts. What thought-provoking question do you have for our listener today? All right, I'm ready for that thought-provoking question you mentioned.
Well, after exploring all these aspects of health assessments, I kept coming back to this idea of communication and trust.
Okay,
Imagine you're a nurse, and
yeah,
you're facing a patient who seems reluctant to share information about their health.
right.
Maybe they're embarrassed, scared, or just don't trust the medical system.
Mm-hmm.
How would you approach that situation?
That's a really good question.
Yeah.
I can see how that would be a delicate situation. You don't want to push too hard,
Right.
but you also need to gather enough information to provide the best possible care.
Exactly. It really highlights the importance of empathy and active listening in nursing.
Right.
Sometimes it's not about asking the right questions,
Yeah.
but about creating a safe space for the patient to feel heard and understood.
So it's about more than just the words you say.
It is.
It's about your body language, your tone of voice,
Mm-hmm.
and your genuine willingness to connect with the patient on a human level.
You're absolutely right. It's about showing them that you care,
Mm-hmm.
that you're not just there to treat their illness,
Right.
but to care for them as a whole person.
That makes me think about something you mentioned earlier,
Yeah,
treating the whole person rather than just the disease.
right.
That seems to be a recurring theme in nursing.
It is, and is a core principle of patient-centered care.
Okay.
It's about understanding the patient's individual needs, preferences, and values.
Right.
It's about recognizing that each person experiences illness in their own unique way,
Mm-hmm.
and that there's no one-size-fits-all approach to care.
So it's about tailoring you care to fit the person
Yes,
rather than trying to fit the person into a standardized protocol.
precisely. And this might involve things like involving the patient in decision-making,
Okay.
providing emotional support,
Right.
or simply taking the time to listen to their concerns and answer their questions.
It sounds like nursing requires a lot of empathy and compassion.
It does.
It's not just about having technical skills and medical knowledge.
You're absolutely right. Those qualities are just as important, if not more so, than any textbook knowledge.
Well said. You know, while we were going through all this information about health assessments,
Uh-huh.
I was struck by the sheer amount of detail involved. It seems like nurses have to be incredibly observant,
They do.
paying attention to even the smallest details.
It's true. They have to be like detectives, noticing subtle clues that might be easily missed by an untrained eye.
Right.
They pay attention to everything from the color of your skin to the rhythm of your heartbeat.
And they have to be able to connect all those spots, right?
Yes,
To see how all those seemingly disparate pieces of information fit together to form a complete picture of the patient's health.
exactly. They have to be able to synthesize all that information and make sense of it. They have to be able to see the forest for the trees.
It sounds like a challenging but incredibly rewarding profession.
It is, and I think it's a profession that deserves our utmost respect and gratitude.
Well, on that note, I think it's time to bring this deep dive to a close.
Agreed. I hope our listener found this exploration of health assessments as enlightening as we did.
Me too. And I hope it inspired them to be more proactive about their own health
Right.
and to appreciate the amazing work that nurses do every day.
Absolutely. Remember, you don't have to wait until you're sick to start taking care of yourself. Pay attention to your body.
Right.
Listen to what it's telling you. And
Hmm.
don't be afraid to advocate for your own health.
Wise words. Thanks for joining us on this fascinating journey into the world of nursing.
My pleasure.
Until next time, stay curious and take good care of yourselves.